Hi, I'm Kylie, and I am a normal birth consultant, antenatal educator, doula, and placenta encapsulation specialist. So I'm really passionate about educating and about empowering mums and dads to make their own decisions. And I feel very strongly that they can only make their own decisions if they know what choices are available. And that's not just knowing what the choices are, but knowing what the pros and the cons of each choice is, so that they can actually look at everything and decide which is the best fit for themselves, their baby, and their whole family. And during the years I've been supporting parents through childbirth, it's been a great pleasure and honour to be there with them through their journeys, and I've supported them through many different types of birth experiences. So ranging from normal birth without medication to home birth, vaginal birth after cesarean, lotus birth, water birth, and even normal breech vaginal birth. So what can I do to help? One of the things that I can do to help you is to help you explore your options, help you explore what are the choices available to you, and considering that in relation to your own personal circumstances and where you are, where you're at. So we can talk through the different options and choices, and then you could feel more confident that you're making a decision that's the best one for you and your family. I can also help you by giving you some ideas and strategies and teaching you some different tips, things that can really make a big difference about whether or not birth unfolds in a more normal way or not. So for example, there are very simple nutritional things, there are very simple natural remedies, and there are lots of tools and strategies about relaxation and positioning, which can make a big difference about your baby's position for when birth is about to happen. I'm also here to talk with you about and listen to you about any fears and worries that come up during pregnancy. It's very normal during pregnancy to have fears and worries about your baby, about labour and birth and how it's going to go. And sometimes those fears come from stories people have shared with you, things you might have read in magazines. There could be something you've watched on the television, or it might be from a previous birth experience you've had. So I'm here to listen and talk, and there are certainly things that we can suggest and discuss, and strategies that can help you to deal with those fears, because those fears, if you carry them into labour, they can really get in the way, and they can even stop and slow things right down. So it's important to deal with them when they come up. I can also support you through the postpartum. You might be calling me in the postpartum for us to talk about things like breastfeeding, bonding with your baby, how to take care of yourself in the postpartum. But I can also talk to you about these things during pregnancy, so that you can be well prepared and organised, so that you know you've got all the right things in place to make things as easy as possible in those first weeks. And also, talking about the postpartum, there's the subject of placenta encapsulation. I'm here as a resource about placenta encapsulation. I can give you information and discuss the research with you and help you to understand what the benefits of placenta encapsulation are. The benefits not only to the mother but to the baby. And because there are benefits to mother and baby, it benefits the whole family because it makes things easier. So I'm here to answer any questions that come up from mums or dads or any other relatives who are thinking it's sounding a little unusual. So I'm just here to discuss those things with you. Right throughout my working life as a paediatric speech and language therapist, and also as a birth supporter and working with birthing women, I've worked with people from a wide range of backgrounds, from different cultures, people with different values and belief systems. So I'm very open-minded and I'm non-judgmental, and I'm always happy to just talk with you from where you're coming from, and look at whatever issues around birth, pregnancy, labour, postpartum that you might want to discuss. Because birth isn't a 9 to 5 thing, I've decided to make myself mostly available on evenings and weekends, and that's pretty much because that's when couples come together to talk about things, and that's when the questions will come up, and you might want to pick up the phone and have a chat. If you want to have a chat at a time when I'm not listed as available, then all you need to do is put in a request, and I will make every effort to make myself available as quickly as I can. Some of the things that I can help with include different ways of approaching conditions such as group B strep. There are different things that you can do to try and minimise that. And also looking at diet, how to maximise nutrition and ensure that you're getting the right things at the right stages of pregnancy, and that can then lead on to help preventing other conditions developing later on. There are also different things that I can help you with, which can help to avoid going too far overdue, or to encourage your body to be ready to go into labour sooner rather than later. And there are lots of very natural, safe things, and I can certainly help by discussing those with you so that you can decide if they're for you. So my clients tend to have a very high success rate of normal birth, and definitely vaginal birth, and I have a very, very low rate of caesarean section among my clients. And most of my clients tend to approach birth in a very empowered way, and they make their own decisions as they move through in an informed way. They know all the information they need to know, and they come out of birth at the other end feeling like and knowing that the decisions they made at the time were the right decisions for them and their baby. Working with pregnancy, labour and birth for me was completely unexpected. I wasn't a child that grew up thinking I wanted to be a midwife, or I wanted to work with babies or with women. It was something that came completely out of left field for me, but it was once I found it, it just really ignited something in me, a passion that was like, no, this is really important. It's so important for women to know about natural, normal birth and know their options, and can actually be empowered by the process of birth. And it doesn't have to be a medicalised experience. It can be a normal process. It doesn't have to be in hospital if you don't want it to be. There are choices. It can be at home. It can be in your kitchen, in a pool. It could be, done in so many different ways. And for me, I think one of the most amazing things about supporting women give birth is particularly supporting women who didn't think they could do it, or who had had previously traumatic or difficult births, and they've just had their baby in their kitchen, in their pool, and they're just like, wow, I did this. And you can see that it's completely shifted and changed their world.